Getting the COVID-19 booster is about doing our part to love and protect our families. Vaccines are a life-saving tool in the fight against the virus. Over time, they become less effective at preventing serious illness, just like other vaccines. We need the boosters to increase protection against COVID-19 and its variants, ultimately preventing us from getting really sick or dying. So do it for your family, especially those at higher risk. Protect the ones you love. Vaccinate.
Hi, I'm Letitia Stein, the Inquirer's health editor. Thank you for joining us today for an Inquirer Live health report presented by Independence Blue Cross. Since the start of the COVID-19 pandemic, public health has shaped our daily lives as never before, from how people come together for work and social events to whether precautionary measures like vaccines are required to dine out. We continue to live in interesting times as 2022 winds down. COVID remains a health threat, yet we are moving toward a new normal with this virus. Today, that means living in what experts are calling a tridemic or tripledemic moment, as an unusually severe and early wave of flu sickness and other respiratory viruses hit all at once. To help us understand what's going on, as well as critical issues for the future, we will be joined today by two national public health leaders, Philadelphia Health Commissioner Dr. Cheryl Bettigole and White House COVID-19 Response Coordinator, Dr. Ashish Jha. We'll hear their thoughts on the White House's COVID strategy, how the pandemic has changed public health, and the challenges facing public health in the year ahead. Additionally, helping to provide insight and context for our conversation, we welcome Jason Laughlin, a health reporter at the Inquirer who has been covering the public health response to COVID for the past 2.5 years. For those in the audience today with questions for our speakers, please submit them in the comment section. If you're watching us on social media, go to inquirer.com/live to do so. Now welcome Drs. Bettigole, Jha, and Jason. Thank you all so much. Shall we start by diving into questions about the virus that has been part of our daily conversation now for almost 3 years, COVID-19. Dr. Jha, what is your assessment of where we are currently in this pandemic? And can you elaborate on the White House's announcement today that it will be making free COVID-19 tests available to households again by mail? Why are you doing this? And what are the other key elements of the plan that you put out today to prepare for seasonal illness this winter?
Yeah. Well, first of all, thanks for having me here. So obviously, if you take a look at that 3-year time horizon, we're in a much better place than we've been, right? The virus, while still out there and still causing significant problems, is not the same disruptive force that it was. But right now, what we are seeing across the country is, and not surprisingly, increases in cases and increases in hospitalizations due to COVID-19. Of course, in the background of what you described, Letitia, that we have, we have flu, we have RSV, so our healthcare system's already pretty stressed, and we're seeing this now clear increase in both infections and hospitalizations. And if the last couple of winters we have seen significant waves of infection, and our job right now is to try to do everything we can to protect Americans in the days and weeks ahead. So we have laid out a plan. And the plan makes testing more widely available. You can go to covidtest.gov and order 4 free tests that'll get delivered to your home. We're doing a lot more in getting tests out to nursing homes and food banks and homeless shelters and lots of other places. We're really re-upping kind of our efforts to make sure that vaccines are widely available, working with cities and states to set up pop-up clinics and to make test-to-treat sites available. And then the last part is we're really redoubling our effort around nursing homes, because nursing homes is obviously where a lot of people have gotten very sick in the last couple of years. We really want to make sure that nursing homes and other extended long-term care facilities are well protected with vaccines and treatment. So it's a multi-pronged strategy, but with a very specific goal, which is we do not want this winter to look like what last winter looked like or 2 winters ago looked like. We think we can have a different winter if we do all these things that are really necessary, like getting people their updated vaccines and getting treatments. Obviously, if we don't do those things, it could end up being a much tougher winter.
Well, vaccines are an interesting question in their own right. Dr. Bettigole, flu, COVID, and to a lesser extent, Mpox vaccinations are all competing right now for the public's attention. Do you see signs of vaccine fatigue, and what are you doing about that?
So, it's a little bit hard to tell because the flu vaccine data doesn't come in daily in the same way that we've gotten COVID vaccine data. So what we're seeing here in Philadelphia is numbers that are a little bit lower than we've seen in previous years. I think the more important factor right now is that overall flu vaccine rates are too low anytime. So we're really trying to encourage people to get both their bivalent boosters and their flu shots to make sure they're fully protected. And particularly concerned both with seniors who are at highest risk from both flu and from COVID-19, as well as young children. We've seen here in Philadelphia, our ERs filling up, especially our pediatric ERs with young kids who are having problems breathing. And really, there's a nice match between flu vaccine this year and flu. We'd really love to see kids get both their bivalent vaccines and those flu shots.
Jason, can you help us talk a bit more about the latest bivalent vaccine for COVID? You recently had an interesting story in which you profiled another of the nation's leading experts, Dr. Paul Offit of the Children's Hospital of Philadelphia. And he is an expert who advises the FDA on vaccine recommendations as well. Can you tell us why he disagrees with the CDC's guidance, as well as that of the Philadelphia Health Department, that most people should be getting this latest COVID bivalent vaccine?
Yeah, I actually told Dr. Offit we were having this conversation. One of the first things he said was, don't make it sound like I'm opposed to boosting. He said, I absolutely think people who are immune compromised, who are older, who have comorbidities should get the booster shots, should get the bivalent shot. His issue is how widely it's been recommended. His concern is that the evidence just isn't solid that this shot is significantly better than the previously available shots. And he has been generally skeptical of booster shots. He believes that there is a range of antibody response you can get, but the more long-lasting immune response that's going to protect people from serious illness and death may be in place with 2 or 3 shots, and additional shots beyond that aren't going to get a lot more benefit.
Dr. Bettigole or Dr. Jha, would either of you care to elaborate on your perspective on this?
I can start, Dr. Jha, if that's okay, and
Please.
we can maybe tag team. And I do want to say I have tremendous respect for Dr. Offit. He is a nationally renowned expert, internationally renowned expert on these vaccines. I think, though, that there's some nuance to the messaging that maybe is just important to pull out. And it is that emphasis on just how important those boosters are. We say for older adults in Philadelphia, I really would love to see particularly people over 50. And as somebody over 50, I will say, it's not that I'm saying people over 50 are old, but when we look at who's at risk, certainly people over 65 are at high risk. And age is the number one risk factor. Even if you are a very, very healthy 65-year-old, please get your booster. But people over 50 tend to have more of the risk factors that can lead to severe COVID. Carrying some extra weight, high blood pressure, heart disease, diabetes. Any of these add to risk factors. And in Philadelphia, many of our over 50 folks have multiple of those risk factors. So getting those boosters is really, really important. And I think in the whole, what Paul is trying to describe is kind of a nuanced discussion about exactly who needs it. But the thing that I worry gets lost is that hospitalizations and deaths really are going up, particularly in older adults, as we get further out from that primary series. So the boosters are really critical in protecting people and avoiding, that huge winter wave. Last year in Philadelphia, we lost 750 people in that winter Omicron wave. And I do not want to go back. And I don't think anybody in Philadelphia wants to go back to that.
Yeah, let me add on this that there have been, and I'm not going to talk about Dr. Offit specifically, but in general, there have been people who've been booster skeptics. There were booster skeptics last fall. The evidence was overwhelmingly clear that people should get that booster last fall. And those 750 people that we heard about who passed away in Philadelphia and the tens of thousands of Americans who died, almost all of them were people who had not gotten a booster. Like, the data on this is overwhelmingly clear. In the spring and summer, there was a lot of skepticism about kind of for older Americans, that second booster. The data was overwhelmingly clear from Israel. If you got that booster, you were dramatically less likely to die. I think the scientists at the FDA, the career scientists at the FDA, they thought the data was very clear that these things should be recommended for every adult, and now for kids as well. That's where the CDC scientists are. I spend a lot of time talking to scientists across the country on an ongoing basis. I think the broad consensus is that people are better off with the bivalent booster. The broad consensus in the scientific community is that the bivalent booster is substantially better than the original booster. And so, look, there are going to be individual people who are going to have their individual views. My job sitting at the White House is to look at what do all the broad range of scientists, Dr. Fauci and the folks at the NIH, what do they think? What does FDA think? What does CDC think? What do the broader scientists think? This is one where there's actually a lot of consensus that this new bivalent vaccine is a clear improvement, and that it is absolutely essential for people, especially if you're at elevated risk of getting this booster. It's going to make an enormous difference on whether you get sick or not. That should be our message. That is our message. There's actually quite a bit of scientific consensus.
If I can add one additional thing, when we look at our local data here in Philadelphia, people who are boosted have been substantially less likely to be hospitalized and to die. So what's true nationally is also true here.
It's interesting. Thank you for that. For those who are joining us in the audience today, if you have questions or comments, please submit them in the comments section. And if you're watching on social media, just a reminder that you can go to inquirer.com/live to do so. And some of the early questions that are coming in, they're touching upon a topic that I was hoping to ask next about, which is namely that Philadelphia schools announced today that students will be returning to mandatory masking for 10 days after winter break. Should we be bringing back mask mandates in other settings? Dr. Bettigole, would you like to talk a little bit about where we are with masking and your thoughts on that?
Sure. So Philadelphia, over the last 2.5 years, has been one of the places in the country with the highest rate of mask use. And, we stopped mandating masks because it became very clear that our population understands this and that people actually will put masks on when they understand risk. So throughout the fall, we've been strongly recommending masks for any crowded indoor space. And I would definitely continue to do that through the holidays. That doesn't mean that, if you sit down to have lunch with a friend, you have to keep a mask on and take it off between bites. But if you're getting on the bus, you're going to the mall, you're going to a store, having a mask on just lowers your risk. Now, schools are a little bit of a different setting, right? Where kids are going to be, they have to be there. They're there all day long, close together. So I do feel very strongly supportive of the school district's decision. I think what they're trying to do is what we want them to do. It's keep kids in school, and if kids have COVID, they can't come to school. So, I think it's a good decision. It's relatively brief, right? It's just 10 days after the break, but I think it probably will help prevent some of the absences that we've seen previously, missing a lot of school, being short of staff and so on, trying to just make sure our kids are learning.
Dr. Shah, is there anything you would share on the national perspective and guidance when it comes to masking?
Yeah, so a couple of things. I mean, what my view on this is really quite clear, which is the evidence suggests that if you wear high quality masks, it clearly makes a difference both in preventing spread to others. Poor quality masks, cloth masks that don't fit well, just especially against Omicron, probably don't do that much. So it's really important if you're going to wear a mask to wear a high quality mask. From a policy point of view, my feeling has been actually well before I came into the administration, that these are decisions made best at the local level by local leaders. We have a very broad and diverse country, and leaders understand their communities well and understand it best. And what may be right for Philadelphia may not be right for San Antonio, and maybe different than what Seattle wants to do. And I actually think that's reasonable and it's okay. So I've been very supportive of the decisions that individual cities and counties and states have made. But I think there's this question that we sometimes get into of do masks even work or not? And I think the evidence on this is pretty clear. If you're wearing a high quality mask, it clearly makes a difference. And I don't think that evidence is all that controversial.
Jason, just to ground this conversation in the context of the latest trends, which you've been writing about and have another story out today, where are we right now? What are we seeing in terms of just the case counts, hospitalizations, to the extent that, we are now tracking this still in Philadelphia and also around the vaccine?
Yeah, both in Philadelphia, as well as in both Pennsylvania and New Jersey, cases are going up, hospitalizations are going up, deaths are going up, which is obviously at a much lower scale than we've seen in previous winters, but still up is the wrong direction for any of these. Very quickly, I did look through some of the vaccination numbers for our region, and I'm sure no surprise to both of you, uptake of the bivalent shot has been really low. Roughly, it looks like maybe 10% of the Philadelphians who have gotten at least a shot have gone on to get the bivalent shot, and statewide, about 13% of people have gotten it. And surprisingly, numbers are low among the exact population we were just talking about. I think this is a very, very rough number, but somewhere around a third of people 65 and older in Pennsylvania have gotten that bivalent shot. So that, I mean, I think that's something that's going to be a concern for you going forward and into the new year.
And maybe that'll help us with sort of a final COVID question before we move on. And Dr. Zhao, if you'd like to perhaps take the first answer to this one. Your plan today with the White House, it notes the need for states and communities to be making vaccines widely available. Some means suggested or encouraged are pop-up sites, mobile clinics. Philadelphia in earlier stages of the pandemic has used these techniques, these tools, often not reaching huge numbers through them. So what is the right strategy for the time they're in right now? And why not be also looking at things like infrastructure investments, right? Whether it's ventilation or things of that nature in public buildings.
Yeah. Well, first of all, it's not an either or, right? Vaccines remain the sort of central part of, I think, protecting the population, but there's a whole bunch of other things we need to be doing. In terms of what exactly is going to work, again, we really are a big, diverse country, and different communities. It's not even that the different cities need different strategies. Different communities within cities need different strategies. And when I think about, cities I know better than Philadelphia, which is not a city I know as well, but New York or Boston or other places I've lived, what is going to work in one neighborhood won't work in another neighborhood. And so, local leaders understand that. And we have been encouraging people to figure out what would be most useful. And then we are here to help. We can help set up clinics. We can help set up pop-up clinics. We can set up test and treat sites. So there are things we can do to help. But what exactly is necessary is something that local leaders really understand best. In terms of other investments, there are a lot of dollars that came out of the American Rescue Plan given to cities and states for investments in improving indoor air quality. I actually think this is probably the most important long-term thing we can be doing for schools, for office buildings, for nursing homes. Indoor air quality has just not gotten the level of attention it deserves. Most experts believe that if we make some basic investments in indoor air quality, we can reduce all respiratory infections by 30, 60, even 80%. I mean, the notion that you could cut respiratory infections, there's no study in the world that shows that masks work that well. So you're never going to get the kind of benefit from mandatory year-round masking as you would from making substantial improvements in indoor air quality. But it's a lot easier to implement as well. So this is an area where we're doing a lot and trying to really encourage people to use the resources they have to make those investments and start really improving ventilation and filtration in buildings.
That's interesting. Dr. Bettigole, what do we know in terms of the local piece of this, right? What is Philadelphia working on and what will work here?
So we've been doing a lot of work to push out information about the bivalent boosters and about flu shots, and in particularly to reach communities. For example, the Latino community in Philadelphia, very, very highly vaccinated with the primary series, but very, very few people have come back and gotten that booster. And I think that there's some, vaccine kind of burnout. People were willing to get those first doses. It's harder. But I think it's also a reflection of the tremendous grassroots effort that went into that first series, people going door to door to sign people up for vaccines, which is incredible, but it's hard to keep going. People had to go back to their jobs and what they were doing. So we're hoping that kind of a big blast of media will help on this. I do think that a piece of the answer here lies in primary care and in routinizing these shots and, figuring out how to make that happen. Some of this is simple logistic, well, not simple, but logistic things like single dose vials. people are very reluctant to break into a 10-dose vial if they're going to give one dose. And so just trying to think about what are the various barriers to getting this into, when I go to my doctor, the reason, frankly, that I got a flu shot this year is I had to go to my doctor just for a checkup. And the medical assistant asked me if I wanted a flu shot before I saw my doctor, and then just gave me the shot. Like, it's just part of their protocol. So I got a flu shot. I didn't have to be organized about it. It just happened. And in building in that, I think in the long term is what we need to do. But in the short term, we're doing a lot of media. We still are offering walk-in COVID vaccines at our health centers, which are in neighborhoods where we really need to deepen our reach. Really, particularly the folks who are over 65, we just need to reach. And so, the other thing is just Philadelphia, please talk to your neighbors and your friends or your relatives and ask if they got a booster, and maybe go together and get your boosters. We really do need to do this together.
Thank you. Along those lines, maybe a question that's coming to us from those who are here watching in Philadelphia. This is a little bit more of a technical question, but someone asking if we had a rebound, if you have a rebound of COVID, do you recommend a second course of Paxlovid, especially if you are immunocompromised? Do either of you have an answer to that?
So I think that there is a recommendation for longer courses of Paxlovid at this point. I don't know, Dr. Shah, if you have another take on that.
I don't know the answer to this, and so let me say one thing about rebound in general. Just because it got a lot of attention. There's now really good data that there's just COVID rebound, that a lot of people who get COVID who don't even get treated with Paxlovid will have a rebound. It's just a feature of the virus. And then about probably 15% of people, 10 to 15% of people who get Paxlovid will have a rebound. Now, again, in non-immunocompromised, kind of otherwise, healthy, maybe older adults, that rebound is very mild. We don't see people ending up in the hospital getting very sick. So rebound is not a reason not to prescribe it. For people who are immunocompromised, I actually don't know. This would be an FDA decision around authorization. I don't know the answer to what FDA has recommended. There's clinical intuition that says it might be reasonable, but this is an FDA decision. I just don't know what FDA's recommendation on this is. I would say to this person, talk to your doctor about it. I think that's what's important.
Exactly.
Thank you. Let's end. Our time together is limited. So maybe we can just step back for a moment and acknowledge, as you all have been talking, that we are not only dealing with COVID at this moment in time, right? We have a lot of respiratory viruses that are causing sickness, particularly as noted in the pediatric settings. Dr. Shah, there's a phrase that's being used right now, immunity debt. What does that mean? And can you explain, is this a real thing, and how does it apply in the moment that we're dealing with right now?
Yeah, it's a classic term that then people have sort of turned on its head and are misusing it. So let me explain a couple of basic things. First of all, there are a lot of people who are upset that we didn't have a lot of respiratory infections in the last couple of years because of all the mitigation we did with COVID. And they somehow think that's a bad thing and that infections are good because they build up immunity. Let me be very clear. It's never good to get an infection. If you can avoid an infection, that's always better than not avoiding an infection. For an individual, fewer infections is better. But on a population level, when a population has not had a lot of infections, it is a bit more susceptible to a bigger wave of infections. That's just a reality. So in the last couple of years, we've had less flu, a lot less flu. We've had a lot less RSV. And that means that this year, when mitigation has been close to zero and people are kind of living their normal lives, it is not surprising that we're going to see more flu, more RSV. And some people describe that as immunity debt at a population level, that there's not as much immunity. In a typical flu season, 10 to 20% of people end up getting infected. We've had mild to no flu season the last 2 years. So just the number of people who had immunity to flu. And so my point on this is we should focus on the fact that this is not surprising that this year, with little mitigation, we're seeing big outbreaks of RSV and flu. Doesn't mean that our policies in the past were wrong. It means we just need to focus on taking care of people this winter and getting through this winter with RSV, flu, parainfluenza, all the other viruses, and of course, COVID. And if we do, we're going to be in better shape once we get past this winter.
Thank you. Well, we have just minutes left together, so perhaps in rather rapid fire, could we all take a turn at saying, what do we see as being the pressing issue or issues before public health in the coming year? Dr. Bettigole, would you like to start?
I'm going to give you an odd answer to this. I actually think social connectedness is maybe the most pressing issue. I think we've become very divided and very divisive, and getting past that would get us through a lot.
Dr. Jha, what are some of the issues that you consider to be pressing for 2023?
Yeah, I think about the fact that we are now living in the golden age of vaccines. These two mRNA and the Johnson other vaccines that were developed for COVID create a platform. We're going to see a lot more new vaccines coming online, great flu vaccines, great vaccines against other diseases. And while we're living in this golden age of vaccine technology and vaccine development, we're also living in an age where there's so much bad information about vaccines that have been miracles for generations are going to get underutilized. And so it's going to be a very odd period of time where we're developing better vaccines and many people will not be using it. We have got to make sure that is not the divide that we get into. And figuring out how to rebuild that confidence in vaccines is going to be one of the biggest public health challenges we have.
Thank you. Jason, are there thoughts you would like to share as we wrap up?
Yeah, I think my take would be similar. I think that the skepticism that the public has towards public health guidance is a major obstacle, and that's in part due to misinformation. There was some messaging issues over the course of the pandemic that turned people off, and you get to a point where I think people are just not sure what to believe, and breaking through that and getting people to do things like get vaccinated shouldn't be as hard as it's become.
Well, thank you all so much for joining us again for the Inquirer's Health Report presented by Independence Blue Cross. To read more about our COVID coverage, please visit inquirer.com/health. Dr. Bettigole, Dr. Jha, Jason, thank you very much. Appreciate your joining us today.
Thank you.
Thank you.
Thanks.